Welcome back to another brand new episode of Review Remedy by ScoreDoc. When care feels urgent, messy, and honestly, a little scary, reviews stop being background noise and start becoming reassurance. In emergency medicine, people are usually scanning for a few very human clues. Did someone get seen fast? Did the staff explain what was happening? Did the whole experience feel organized when everything else felt out of control?
Right, and that's why emergency reviews are a little different from, say, choosing a routine specialist. In a stressful visit, patients remember operational details with real clarity: wait times, triage speed, whether communication stayed clear under pressure. So, for Houston and the surrounding area, ScoreDoc compared 45 emergency medicine clinics and looked at the last 24 months of feedback to find the providers showing the strongest, most stable review patterns.
And that 24-month window matters. 2 years is recent enough to reflect how a clinic is running now, not how it ran under a totally different team or process. ScoreDoc's method weighs recent ratings, total review volume, written sentiment, and consistency across major platforms. In this report, the core consumer-facing platforms were Google, Yelp, and Facebook. And the goal wasn't to crown some mythical, perfect ER. It was to identify clinics with reliable, measurable trust signals.
Exactly. And I want to underline one phrase you used: reliable. A single 5-star burst doesn't tell you much, but a strong rating combined with high review count, recent activity, and positive written sentiment, that starts to become a pattern. Out of those 45 clinics, 5 rose to the top: Ally Medical Emergency Room, Clear Lake; Elite Care Emergency Hospital, Post Oak ER; Rice Emergency Room, West University; and South Shore ER Emergency Room Urgent Care, League City.
Okay, let's hit the numbers, because this is where the picture sharpens. Ally Medical Emergency Room, Clear Lake, posted a 5.0 rating, 831 total reviews, 180 recent reviews, and 98.7% positive sentiment. That 98.7% is the kind of figure that tells me patients aren't just satisfied in general. They're describing a very consistently positive experience.
And Rice Emergency Room, West University is right there in the top tier too. 4.9 rating, 608 total reviews, 171 recent reviews, and 97.2% positive sentiment. What stands out with Rice is balance. High rating, large enough sample size, very solid recent activity. That combination tends to be more useful than a flashy score by itself.
But then you get South Shore ER Emergency Room Urgent Care, League City. And the number that jumps off the page is 1,989 total reviews. 1,989. That is a big review footprint. Add 555 recent reviews and 98.1% positive sentiment, and now you're not looking at a small pocket of happy patients. You're looking at sustained engagement at scale.
Yeah, 1989 is hard to ignore. That's the kind of volume that makes trends more convincing, because it's tougher for sentiment to stay that strong over that many experiences unless systems are actually working. The other two on the list matter here too. Elite Care Emergency Hospital came in at 4.8 with 635 total reviews, 219 recent reviews, and 93.7% positive sentiment. Post Oak ER also held a 4.8 with 268 total reviews, 70 recent reviews, and 93.3% positive sentiment.
And even those low 90s sentiment numbers are still strong, especially in emergency care, where people are often reviewing from a place of pain, stress, or exhaustion. The recurring themes across these 5 clinics were really consistent: prompt care, professional or attentive staff, clear diagnosis or communication, efficient service, accessibility. Patients kept describing experiences that made them feel less stranded in the process.
I do want to add one caution, because reviews should narrow the field, not make the decision for you. A clinic can have excellent reputation indicators and still not be the right fit in a specific moment. Location matters. Available services matter. If you're dealing with a child, an elderly parent, transportation issues, or a situation where every extra 15 minutes feels enormous, family logistics matter too.
That's such an important distinction. Reviews help answer, can I trust this place to treat people well? But in an actual emergency, the other question is, can I get there quickly? And can they handle what's happening? Those are not the same question.
And maybe that's the real takeaway from Houston's top 5. The strongest clinics didn't just collect stars. They generated repeatable patient language around fast response, attentive staff, clear communication, and a process that felt less chaotic. In emergency care, that feeling, not being left confused, not being left alone, that may be the review signal people remember most.